devil got to creep in somehow, man. And that's when I experienced one morning in 2021 November that I just woke up a little off. Things didn't feel right. We went to the hospital and everything. You know, they just couldn't see nothing. They sent me home, and the next week, Thanksgiving morning, I woke up and them telling me that I had 3 seizures.
To be in a situation where you feel like, whoa, like I have to make like serious changes to my life if I want to extend my life.
It's like you make up your mind and make your changes on your own, or the game will force you to make changes.
In that moment, it was like, the normal, opening dub to me. It wasn't until I got around you, when I got dropped off out there, is when I noticed what was really going on. You definitely was in a different mindset.
People think of seizures like, it's 1 to 2 minutes of a seizure, 2 to 3 times a month. It's like, 6, 7, 8 minutes out of your life. But the people spend 99% of their time trying to avoid those 6, 7, 8 minutes. And that really impacts their quality of life.
I just want to walk y'all through, let y'all talk to a professional neurologist who specializes in the brain. Dr. Kim Hatchett, I want to thank you first for taking the time to come on here and talk about this with us. So you're a neurologist, speaker, author, wife, mother.
Right.
Correct? So I already shared with my followers prior to us joining that I do have epilepsy. And I was diagnosed in 2021. And I didn't even know I had it. I didn't even know, too much of what it was. Could you just say from your point of view, what is epilepsy? Is it like a condition, a disease, a disorder? Like what is epilepsy?
So it's a disorder. So it's important to distinguish the difference between epilepsy and seizures. Okay. About 1 in 10 people in this country will experience at least one seizure in their life. That seizure could be provoked or unprovoked, right? Okay. Yeah. And then, but once you have epilepsy, that means you have more than one seizure happening, and it could, now your epilepsy could be a provoked epilepsy, meaning like a structural problem with your brain, or could be some type of genetic or metabolic problem. But you're having more than one seizure, and you're having to be controlled with either medications or surgery for that seizure. So having more than one seizure, mainly unprovoked seizures, makes you have epilepsy, which is a disorder. There's 2 different groups of people that can develop epilepsy, or I should say have a higher risk of developing epilepsy. So kids up to the age of 10 can develop epilepsy for most likely some type of genetic or structural abnormality that they were born with, something that happened when they were in utero or in the womb, or something genetic, something with their DNA that's increasing their risk of getting epilepsy. So up to the age of 10, kids are at increased risk of epilepsy. And then after the age of 55, people who are older are at risk because of things like strokes, Alzheimer's disease, and things like brain tumors or brain injuries. Gotcha. But also you can have an increased risk of epilepsy from structural issues, like hitting your head and getting a traumatic brain injury. And then some people just have an idiopathic, meaning we don't know the cause, but they just suddenly develop epilepsy.
Is there anything like maybe drinking or vaping or marijuana that could cause you to have a seizure, or could that maybe add to you having epilepsy, or
that could cause you to have like a seizure? Okay. So alcohol doesn't necessarily increase your risk of having seizures, but chronic drinking and then stopping drinking can cause you to have what's called an alcohol withdrawal seizure. So we see that in the hospital a lot. But then things like vaping, cocaine, those types of drugs increase your risk of having seizures. Not necessarily developing epilepsy, but absolutely having seizures. Yes.
What's happening to the body like while it's going through a seizure? Because I heard it's like a bunch of neurons in the brain, or like electricity, like what's actually going on?
What's amazing is that our brain is run on like current, kind of like a computer's run on current. Okay. And so we, and I do tests where I look at the velocity of how fast we conduct electricity in certain nerves in our body. But what's happening when you're having a seizure is that there's a sudden, uncontrolled amount of current that's happening in a certain part of your brain. And some people, that part of their brain, it just stays right there. They have what's called a focal seizure.
Okay.
Some people, that current will generalize and spread throughout their brain and take over both hemispheres, causing them to lose consciousness and have a generalized seizure. So it's basically an uncontrolled amount of current that starts in your brain, a focus in your brain, and then it either stays there or spreads throughout your brain and causes you to have either a focal seizure or a generalized seizure. But it's really a loss of consciousness. Like, you don't remember what happened. Focal seizures, you remember. People can have a focal seizure and be very conscious when it's happening. But generalized seizures could either be the ones that people think about, like grand mal, or could be a staring spell where someone is staring off and they're not responding to you. Those people, you don't have any memory of those types of seizures.
Okay. And while we're speaking on memory, because I did notice that after having so many seizures, that it did have an impact on my memory and like cloud up my thoughts and different things. Is that like normal to happen after you have seizures? And would that go away? Could I, get memory back? Like, how does that work?
So it can happen where you have problems with remembering things, remembering because your brain has had basically a surge of energy, and it's having to normalize. So if you have that happen over and over and over again, it's kind of like your brain needs to rest. It's when you think about it, think about running a marathon. So if you ran a marathon and then ran a couple of days later another marathon, and then a couple of days later ran another marathon, your body's not going to work like it's supposed to because it's tired. You built up lactic acid, you have muscle soreness and fatigue. Same way with your brain. If you're having all of these surges of energy happening over and over and over again, it's going to affect your memory. So the best thing to do is get the seizures under control, and then hopefully your memory will come back, and most likely it will happen. Your memory will come back once you've gotten the seizures under control.
Before I actually knew that I had epilepsy or that I had a seizure, there was a thing that I now know to be an aura. Something that happens before you have a seizure, where you can throw up, you can taste or smell things that may not be there. Could you talk about that a little?
Yeah. So an aura is, like you said, is something that happens sensory wise. It's usually something in your sensors. So you might smell something, you might taste something. Some people see things. Some people will have this feeling of unpleasantness in their stomach and start to vomit. And sometimes that could just be the seizure or the start of the seizure, or it's a warning sign to the person that I'm getting ready to have a seizure. So your brain is starting to misfire. So it's like a misfiring of one of your sensor, one of your either cranial nerves or your senses up here, or a misfiring of this the reflex to vomit. So there's all these different centers in your brain, like your vomiting center. There's a center there that controls whether you're vomiting or not, and your brain is sending a signal, or it's misfiring a signal to that part of your brain, causing you to vomit, and it's giving you a warning sign.
Got you. Is there any difference, like, doing your body when it's sleeping, like for you to catch one? Are you more prone while you're sleeping, or how does that?
So there are certain seizures that you can see them happening only in sleep, which is interesting, because your brain goes into different waves when you're asleep. When you're fully awake, you have what's called an alpha rhythm. That means that you're fully awake, your eyes are open, and your brain is functioning at this alpha wave. When you go to sleep, your brain starts to slow down and go into what's theta, which is like 4 to 6, and then delta, which is under 3 hertz per minute. So again, electricity. You're producing different waves of electricity when you're asleep. And when we're looking at patients who have seizures, mainly in their sleep, or we see those abnormalities in sleep, we can sometimes see them even more focally when they're asleep. So when we do an EEG, we encourage the patient to be sleep deprived, so that you can fall asleep, so we can see what your brain does when it's asleep. And sometimes you don't see anything when someone's awake. Their brain looks absolutely normal when they're awake. And as soon as they fall asleep, we start to see these abnormalities. And it just brings out more, for whatever reason, it can bring out more abnormalities when you're asleep. And that's with certain people and certain types of epilepsy. When you're having seizures on prone waking, one thing that a lot of patients will see is that they've either bitten their tongue, They'll have muscle weakness. They'll feel like they've worked out and they're like, I haven't worked out. Like, I don't understand why my muscles are so sore. They'll wake up sore. They'll wake up sometimes with like a bitten tongue, or they'll sometimes wake up confused. They'll feel like they've moved in their sleep and they have no recollection of any of that. Even sometimes they'll say that they've had the strangest dream and they felt like they were awake during the dream. They'll have these like weird, vivid dreams that they'll remember. And most people don't remember their dreams. So that's another sign that something's happened at night.
Gotcha. Okay. And like, how can somebody like support a relative or a friend that may, have epilepsy or experiencing a seizure? Like, what are some of the things that you should do or you shouldn't do?
That's a great question. Okay, so things that you should do for your loved ones if they have epilepsy. You should understand what type of medication they're on and encourage them to take their medication. If they have a seizure in your presence, some of the things you should not do is put something in their mouth. You shouldn't try to hold them down. Some things you should do is if like they have a tie on or something around their neck, try to loosen that. Try to get sharp objects out of the way. And you should time the seizure. If the seizure lasts longer than 5 minutes, or if they have back-to-back seizures, that's when you need to call 911.
Okay, gotcha.
If they also have a rescue medication, some people have seizures bad enough that they have a rescue medication. Know how to administer that rescue medication for the person too.
Once you diagnose with epilepsy, could you get undiagnosed? Could it go away after, like, if you go so long without having a seizure? Could a person, a neurologist, a professional, say that, hey, you no longer have it, or is it once you diagnose, you have to take the medicine forever?
So it just depends. Some people, when they are diagnosed with epilepsy, depending upon the cause, they either grow out of their seizures. So like some kids their seizures will be under complete control and they have gone a year or two without seizures. We might try to wean them off the medication and see if they do okay. So it just depends on the cause and depends on, basically the cause and their frequency of seizures when they were actually actively having seizures. And one thing I want to let your audience know is that for African Americans, we're at a higher risk of being diagnosed with epilepsy, but we are at a much better rate of control of our epilepsy if we take our medications. That is something that the studies have shown time and time again, is that African Americans, if we take our medication, we are have controlled epilepsy at a much higher rate than Caucasians.
I want to ask this last question because I know you're very busy, and I definitely appreciate you once again for coming on here and sharing this with my followers. Before you got into neurology, or while you were into it, like, do you know anyone personally, maybe like a friend or relative that maybe experienced epilepsy or seizures, someone close to you that you had to do the research for, or maybe help?
Well, I will say this: my grandmother did have strokes before she passed away, and the number of strokes that she had did cause her to have a seizure. And so seeing that and understanding that we as a community sometimes stigmatize folks who have things like seizures has pushed me to go into neurology. I thought about surgery at one point, and more I looked into it, I realized that our people needed someone that could be an advocate for them and speak plainly about things like epilepsy so that we can understand exactly what we're going through and how we can help ourselves.
Books or anything that you may have that we can support?
Sure. I'm pretty active on Instagram. My Instagram handle is Dr. Kim Neurodoc, Dr. DRKIM Neuro NEURO Doc DOC. So Dr. Kim Neurodoc. And I have a website, drkimberlyjhatchett.com. So you can follow me on both of those and give tricks and tips on how to make your brain work better. Because again, the brain controls everything.
That's right. Ladies and gentlemen, Dr. Kim Hatchett, thank you so much, and I appreciate you.
All right. Thank you so much for having me. I appreciate you coming with your story and raising awareness for this important disease.
Absolutely. Thank you. I want to thank y'all for watching. I want to thank Dr. Kim Hatchett, because like I said, I didn't know all the information on it until I started doing research after I was diagnosed with it. So just giving y'all a little information, letting y'all know why I stopped doing videos, so y'all be ready for all this new content that I'm about to create. Epilepsy awareness mission that I started, and we're about to get back posting. So until next time, I'm out.